Happy New Year and welcome to everyone to our third annual MLK Day event. Today we'll be discussing a topic that has received a lot of attention in the media and our social circles last year. We'll be talking about reproductive health. But before we get into the discussion, a few disclosures.
Hello, everyone. So we just have to say we are not receiving any gifts or payments from pharmaceutical companies, biotechnology companies, health institutions, or any other private or public institution for today's event. This event will be recorded for educational purposes. All of the information shared here will solely reflect the views of the panelists, and this will include the panelists' research available information, as well as the panelists' own personal experiences. The views expressed in this video are not representative of our associated institutions. This is not to be taken as strict medical advice. All content, including text, graphics, images, and information contained on or available through this platform is for the general information purposes only. As always, please talk to your doctor or qualified healthcare provider for more information. Let's get started.
So my name is Dr. Guinea Ikwezima. I'm an obstetrician, gynecologist, and pelvic surgery fellow from Oklahoma City, Oklahoma. I'll be your moderator for tonight. We want to remind you that our panelists and our audience that this is a medical issue that is a little bit controversial. However, we're here to educate from the medical perspective, regardless of our personal views. And I wanted to remind you to remember to like, follow, and subscribe. And without further ado, I'm reminded by a MLK quote that kind of touches on the healthcare topic. It says, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." And it's quite appropriate given this topic about reproductive health and the implications downstream for generations to come. So I wanted to kind of give us an opportunity to introduce our panelists. And we'll so our esteemed panelists, if you could please introduce yourselves.
Hi, my name is Dr. O'Neill Amadi. I'm originally from the Washington, D.C. area. I'm currently a second-year internal medicine resident working in Detroit, Michigan.
Hello, my name is Janelle Lee Allen. I am a gastroenterologist. I was originally born and raised in Harlem, New York, Harlem World, baby. That's always going to be home. And I am here in the beautiful city and my second home of Detroit, Michigan.
Hi, everyone. I am Dr. Latoria Ellison. I was born and raised in Detroit, and I'm still practicing in the surrounding suburbs, family medicine attending.
And hello, y'all. My name is Dr. Elizabeth Johnson. I was born and raised in Virginia Beach, Virginia. I am a general pediatric attending and soon will be relocating to the North Carolina area.
All right, fabulous. So, man, this topic of reproductive health is such a broad discussion. And thinking about our topic and our discussion today, I think one of us had kind of a definition that kind of encompassed reproductive health. Could you kind of mention that?
So according to the WHO, reproductive health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, and all matters relating to the reproductive system and its functions and processes. Reproductive health implies that people are able to have a satisfying and safe sex life, and that they have the capability to reproduce and the freedom to decide if, when, and how often to do so.
Okay. All right. But, just kind of further break that down, what exactly does that mean to us? We're talking about when we're talking to our respective patients, our family, our friends, how do we kind of break that down from your perspective?
Well, I think that if I may say, Dr. Guinea, that a lot of people in the community, when they hear reproductive health, they automatically think of the most controversial topic, which is abortion rights, okay? But reproductive health doesn't just include abortion, which is a part of reproductive care and health. But it also includes making sure that somebody, is allowed to practice bodily autonomy, right? And they can decide, like Dr. Latoya was saying, when they can reproduce, having the freedom to do such things, and really making sure that also have certain level of, not a certain level, but have dignity when it comes to their reproductive health. Okay.
But when you're kind of getting in that autonomy topic, that's a quite a hot button topic, and there's a lot to unpack with that. Like, what exactly does that mean?
Well, like Dr. Latoya mentioned in the World Health Organization is it's just having the say over your body, right? Having, making sure that you have the right to receive certain care, right? It shouldn't just be, I don't know how I want to say this. It shouldn't be made a political issue. I would say it's just this basic right and need that everybody should have access to is healthcare.
And then I know that, we kind of talk about this. We've talked about this issue before, right? And as you mentioned, Dr. Johnson, the bottom line is the right to say we have what we want to do with our own bodies. And for centuries, our people, our ancestors had in this country the inability to do that. And not just the inability, but also the idea that someone else was profiting off of our lack of choice when it came time to enslavement of our people. So the idea of having reproductive health and reproductive rights is a part of our rights as humans, right? It is a part of our civil rights. Today is MLK Day, right? And his whole, life and his legacy is such a juggernaut for civil rights, for the rights that we come born with, for the rights that we say that we're free. And if we say that we're free, then that means whether we be male or female, as Dr. Latoya and Dr. Ellison read from the World Health Organization, that means that we have a right to have a healthy life, sex life, a satisfying sex life. And that also means that we have the freedom to decide, do I want to reproduce? When do I want to reproduce? And how often I want to reproduce, right? And so I think that really kind of even gives us a nice caveat. This whole day is about introduction, because this whole year, 2023 is dedicated to reproductive health. Last year, Young Black Physicians dedicated to mental health. Certainly that doesn't mean we're not going to talk about mental health during these reproductive health talks. You'll see in just a bit that Dr. Ellison is going to kind of let us know that psychological and mental health is also a part of reproductive health. But again, reproductive health is a big umbrella topic. And tonight we're just really getting into the introduction of it and really kind of hitting on some of the hot button topics, like Dr. Johnson mentioned. Sometimes our minds only goes to abortion, but we'll talk about that tonight. But also a few more items, such as, as we get into this, we're going to be talking about some other alternatives. So there's a lot that we need to discuss. And I think Dr. Ikwezuma was just going to, kind of take it away and let us move to the next section, or either Dr. Ellison.
I have one other thing just to
bring it on home. Yes.
A lot of people also are probably watching this and thinking, well, why are young Black physicians, what does this have to do with like racial injustice? And people need to understand that racial discrimination and injustice is all throughout our healthcare system, including reproductive health. And so for, like Dr. Lee Allen was saying, that for centuries, our reproductive health, and by ours, I mean, Black, brown, or marginalized communities have often, that's been used as a leverage or a way to oppress people who are who are part of certain communities. So it is an important topic, whether people realize it or not.
So before you kind of delve further into that, just to give a little context, as she was mentioning, there's a very complicated history, and Dr. Lee Allen also mentioned a complicated history of obstetrics and gynecology with our history of enslaved and members of the Black community. And there was a physician named James Marion Sims who operated on enslaved women without anesthesia. And so that, came to light, within recent years. Also, when you think about Henrietta Lacks with the and some of those controversial issues, and HeLa cells, if you're not really familiar with that, those are cancer cells that are studied that came from an African American woman that was found to have a cancerous tumor when she went and sought care at the Johns Hopkins University Hospital. And her family, her cells were taken and used for research, which is a very good thing, but there's some intricate aspects of that of consent and other things that happened that did not necessarily happen in that situation. And so, there's a lot of layers when we talk about reproductive health and just frankly healthcare as it relates to African American individuals within the last year. When we were thinking about where we were talking about COVID or other things that we've hit on from the YBP perspective. So I just wanted to mention that as as a highlight for what Dr. Johnson and Dr. Lee Allen were discussing. Anyone else care to chime in terms of how this affects our community? Like, what are your thoughts?
I mean, I think just as something additional to talk about for hot button topic and why this is such a critical umbrella topic. The idea of last year, there were documentaries that even came out on maternal fetal health. And there have been, many Black women who have not been heard when we talk about the reproductive time and the very critical time of the peripartum period. We had our own Serena Williams, who is a global superstar and a Black woman who, after giving birth, she had complications and she was trying to voice that she was not feeling right, but yet instead she was not heard. And it took so much for her to be able to get the treatment that she needed so that she did not have the poorest outcome. So this is another thing that encompasses reproductive health. And I think Dr. Ellison, what I was alluding to earlier was, she was talking about to us and educating us on how reproductive health not only includes, kind of the definition that we have, but also the psychological, the mental, those kind of aspects about reproductive health.
Yeah.
Absolutely.
So, yeah. How does that relate, Dr. Ellison?
So when we think about that, it's so important individually, as well as in our relationships. So when we think about considering life after a mastectomy, so breast cancer causing the removal of one or both of the breasts, and how a woman deals with that, what her life is like afterwards, how that affects her emotionally, and then how does that affect her partner, her family, those around her who loves her, and then the relationship that she's in with another partner. Also with that, consider depression, anxiety affecting more often in males when it comes to things like erectile dysfunction.
Yeah. So what about that? Because like a lot of times when we think of reproductive health, automatically we jump to the female perspective. But what about the male perspective? You have any thoughts about that, Dr. Ahmadi?
I do. I think reproductive health does affect men as well as women, especially when it comes to reproductive actual sex life. And when we talk, I guess the major topic you see with men is erectile dysfunction. As we age, our sexual health does change. And sometimes engaging intercourse might become more difficulter as we later age in life, especially when we pick up more comorbidities or other diseases. Kind of affects how our plumbing or how our sexual activity works. So from my point of view, sometimes I like to look at what can be interfering with that. things like hypertension, diabetes, and also stress, maybe a loss of a job, loss of a loved one, and how that can affect someone's performance and what we can do to fix those things.
Oh, so are you advocating that, I go and get a subscription to like one of those sites like Roman or what is that what it is? No, kid, but seriously, I mean, it's more happen because, I feel like these are topics that we don't necessarily discuss amongst our community. They tend to be embarrassing things. Dr. Ellison had touched on the fact that there's some psychosocial component. A men's vitality is really kind of the topics you were talking about are really what we as Black men, at least from my personal experience, we kind of think of vitality from that perspective.
I think it would be nice if sometimes the medication can help us in that area, but sometimes there might be something else that's preventing from that. So before we start using those medications like Hims or Viagra or Cialis, more than likely you're going to have to have discussion with like a healthcare professional to see exactly are there any identifiable causes that could prevent a medication like actually working. So that's part of the actual visit to get information they try to look into. And unless you make sure that those things aren't there and aren't corrected first, given a medication like Viagra can actually be more harmful than actual helpful. There's been cases where people have actually had low blood pressures and also passed away from using those type of medications. So initially, that initial visit where you talk about those things is very critical when you start talking to men.
That's excellent, and I think what you're referring to is reproductive health isn't just necessarily reserved for, maybe us in our teenage years and in our 20s and 30s. You're talking about further down the line as we age gracefully, is what I'm understanding what you and Dr. Ellison are both saying. And then we're also about body image as well. I think that's what I was hearing. I don't want to take away your words, Dr. Ellison, but that seemed to be what you were mentioning, right?
Absolutely. Because we have to be able to have those physical relationships, we got to love ourselves as well. So learn to cope with those different things. It's going to be vitally important.
That's great. So
can I just add one little tidbit? Like, I know we talked about erectile dysfunction. I love the fact that you mentioned aging gracefully. And I just want to add that sometimes it's not just, there can be young people who have some issues with erectile dysfunction, at least when I was a primary care doctor. And sometimes that can happen in the setting of really uncontrolled other conditions, like sometimes uncontrolled high blood pressure, sometimes uncontrolled diabetes, sometimes, even old injuries, or sometimes, as a young person, especially if you're coming in with a condition like erectile dysfunction, as Dr. Ahmadi said, you need to get checked out, because sometimes we can actually find that there could be some either a growth or some kind of abnormality that we didn't expect, so it is important absolutely to not, as Dr. Ahmadi said, kind of order things online and not get checked out by a doctor, because you just never know. You want to go through the full gamut. You want to make sure that you have everything checked out and all the ducks in order. So it's not just trying to put a Band-Aid on something that actually can be a really big problem.
Okay, that's excellent. So I know we're really passionate about a lot of these topics, and that's great. But I did want to segue to kind of one of the topics we hit on before, which is what we think about reproductive health, abortion. But before we even talk about abortion, what are some alternatives to abortion? What are some things that we should be thinking about before we even get there?
Absolutely. So before we get there, in part before we're pregnant, so it's not just the male condom, there's the female condom. So there's multiple different contraceptives, things to help to prevent pregnancy. So if you already know that is not something that is for you at this time, you can have different medications orally, and of course some of the complications that women may speak about are like the weight gain or emotional emotional surges that they go through by being on those medications, so that there are options.
But what are those medications? Because those are the things I feel like, some of those patients might want to know. Like, for example, what are some common things that you encounter or that you talk about in your practice?
So for me, when it comes to, I have to ask the patient, well, do you think you can take a pill every single day? So
Good question.
if you don't think you can do that, okay, then maybe
Yeah.
we need to be talking about putting something in your arm, which we call an Explanon. So that's something that continuously gives you medication that kind of comes off of the device. You can feel the device and it can stay for 3 years. Or maybe we do an injection and I see you every 12 weeks and we can do another injection again. Or we can do an IUD, something that goes right into the uterus, and depending on the type of device can stay for 5 to 10 years.
Right.
So those things can help to prevent pregnancy. What I like to show, which may be hard on my screen, is I show patients information from reproductiveaccess.org. It's 4 pages of different options for pregnancy prevention, and it gives you things to know as far as like the internal condom. Women don't really know much about that, but hey, he's always saying he doesn't have a condom, the condom's okay. Well, you put in your own condom, it's okay. You be ready because you have to protect you. And it has also how effective it is. So there are so many options to help prevent, and we're always so ready to talk about those things. And if something isn't working, if you don't like the next one, okay, I'll take it back up. No problem. There's so many options. We just have to educate, and you can get that education even before you come to me to start looking up the information, but go to a reputable source.
How about from the male perspective? What are some things? First of all, there's that caveat too. They don't prevent against sexual transmitted infection. So I
Absolutely.
know about that, because there's a misconception out there that, hey, I took the pill or I took contraception, I'm good. No, what she's mentioning is that, those medications will help prevent pregnancy, but you can still get all those other infections. Like, is that what I'm hearing you say?
Absolutely. Thank you for filling that portion in, because definitely it will not protect. It can definitely reduce when it comes to condoms, but definitely talking to your partner about getting tested before you start having intercourse, because things like HIV and HSV or herpes, those things don't go away if you can track those. But also you want to make sure you're not getting the syphilis, and other sexually transmitted diseases, gonorrhea, chlamydia, particularly when there's a thought of pregnancy too, because that can affect your baby.
That's a good point. So what about from the male perspective? I guess, and any of you can answer, are there certain things that you counsel your patients on in your respective practices?
I feel like I think that's one interesting thing, because we were just talking about young people, old people, all the way in the middle. But I feel like no matter what age you are, oftentimes the men that I see, if they're worried about the times that I talk about reproductive health is when something is wrong, when they're having urinations that are painful, when they're having, things that are affecting them every single day. I definitely think that people come in for that, which is a good thing, right? So the point of these things is to be able to educate you beforehand. So I think it's just a good part of understanding that reproductive health means keeping your organs healthy, including keeping you away from disease and being able to recognize at a very early point when something is not right. And I think that comes from education before, when we're very young. And also, I think we have our pediatrician on our panel, Dr. Johnson, because reproductive health, again, like we said, it's not just sex, but it's the idea of reproductive organs and knowing what happens as young people are older and they get mature, knowing that sexual organs will go under changes, hair growth, different, getting your period, for men, having, different anatomy for the testes. So all of these kind of things. I mean, I even remember giving, children, books about health and their body. There's so much of that. That is even controversial. Our health classes and sexual education, that has become controversial, but as physicians, we understand that everybody should be educated about their bodies.
Okay, so you kind of hit on the topic. And did anybody else have anything to kind of touch on as well, Dr.
Well,
Mahdi?
I typically try to have lengthy conversations with men, especially exactly what their sexual history are. To like to have, are they sexually active with men, women, or both? And if they're sexually active with women, do they understand the consequences of having sex with women of reproductive ages, and what it can do to prevent pregnancies if that's what they want to do? Like for men, typically right now, it's only the male condom that can be used to prevent a pregnancy. However, if you want to make sure to do your best to prevent a pregnancy, you want to use 2 forms of birth control. And ideally, I prefer the 1+1 method. If a man uses 1 form of birth control and a woman uses one form of birth control, typically probably in the 90 to 95% chance of preventing pregnancy. When you choose not to use one, that kind of increases or decreases the risk of preventing a pregnancy. So making sure that men understand that, and making sure as well as women understand exactly the risk because of that kind of can help to prevent, again, if this is something they want to do or not. Now, if someone is trying to wants to get pregnant and that's what they want to do, are they doing the right steps in pregnancy treatment, i.e. are they taking multivitamins and making sure they're giving themselves an adequate chance to getting pregnant if that's what they want to do. So ideally, you want to have the conversation to know exactly what the patient wants to do right now and in the future, and are they preparing themselves in order to get that particular outcome they're looking for.
So those are excellent topics, because then you're kind of hitting the other side of the coin, which is like we talked about prevention, but then we also talked about planning, which, remember to stay tuned. We're going to be talking about this later down the line in the year about, that whole process of planning and getting yourself ready when you're actually ready to have a baby, which are excellent things that Dr. Amadi just. Now,
I have a question.
Yeah.
What about the vasectomies?
I know
that's prevented.
Oddly from the men, but there was no mention of that whole surgical.
Oh, look.
Cut
It
what?
can be done outpatient.
I see.
Protect your ladies.
Outpatient.
I see some people clicking in about that topic. All right, so.
Well, let's and all jokes aside, let's also define this what a vasectomy is, as well as what a tubal ligation is, as well as what a hysterectomy is.
Right. So these are kind of did anybody kind of want to talk about that or mention? Feel free. Any of you.
You're the expert, bro.
I can do vasectomy.
Okay, do it, Dr. Ellison.
Yes, because I've seen it done outpatient. He was wide awake and talking to us. So it is. I'm sorry, Dr. Guinea.
Talk about the vasectomy, right?
Correct. Yes, the vasectomy. Yes. So it can be an outpatient procedure. They do go in. And usually, they can use like a scissor method, and what they're doing is trying to cut away the part of the tube that allows the semen to actually ejaculate out of the penis. So that is the goal. So as soon as you get the vasectomy done, which again can be done outpatient, that doesn't mean that you will not still be able to get someone pregnant. I think it's about 3 months that you go back and check to make sure before proceeding to try to have sex without the intent of getting pregnant. So 3 months at least after, and to get checked to make sure that the procedure took, and then you would not allow semen to ejaculate. About 30 minutes to an hour. I was rotating in a family medicine clinic at the time, so it was in just your typical, I go see my doctor outpatient clinic. Didn't have to be done in the hospital or in a surgical suite. So it depends on the physician and their training and their comfort with where they want to do it. But the doctor that I was following at that time was able to do it in their clinic on their procedure day. So again, it took maybe 30 minutes to an hour, and probably because he was explaining a lot to the medical student and resident so that we understand what was going on. No blade was used at all, just scissors to actually just open the skin of the testicles. and get to the tubes where he had to, I don't want to use the word cauterize or burn the tubes from 2 different areas to make sure that it couldn't make it, so that the semen would no longer exit from the testicles into the penis.
I mean, just so what you're basically describing is they actually snip the tube that the semen or what provides the substance for men and women to get pregnant. They cut it and then they separate the area so the tubes that the actual semen could not travel. Is that
exactly? So then that's where Dr. Onu mentioned that 1+1 method. So still using the protection, because you can't still get pregnant until everything is completely has resolved as far as the semen that's already progressed, and then also making sure that the procedure that was done was successful. So the partner still doing their normal pregnancy prevention if that's still what they want to do, and then doing that follow-up visit to make sure that the procedure actually did last.
That's great.
Was it painful for the patient?
Not at all.
Exactly.
Not at all. Yeah, that's a good point. He was sitting talking to us.
So she brings up a great point in terms of from the gynecology perspective. We have other surgical options like tubal, what we call a sterilization procedure, where there's a tubal ligation, where the tubes can be either tied, they can be clipped with an instrument, or they can completely be removed if you're removing a tube if you're completely done with childbearing. And the counseling depends on a lot of different things. It is a permanent procedure that we do, but the other option of that, in terms of if you had to choose between doing that procedure or doing a vasectomy, it is of course safer. Vasectomy is safer when you compare it to a sterilization procedure, because there's no use of anesthesia. There's no use of systemic anesthesia, which is basically putting you to sleep. And with a sterilization procedure versus vasectomy, you're getting that done where you have anesthesia that's used, but it's usually local. You're numbed up so that you don't necessarily feel that discomfort when the procedure is done. And it's an outpatient procedure, which means it's done in a clinic and done in a surgery center typically. So outside of that, you mentioned some contraception options, like, the woman probably needs to be on contraception for 3 months so that any of that residual semen that's doesn't get there. Okay, great. What else outside of what other contraceptive options are there, or alternatives to abortion are there available?
I'd love to talk about Plan B. I think that is so,
So what is that exactly?
So yeah, let's talk about that. So basically Plan B is a form of birth control that is in high doses that you can take if you have had intercourse already, and it's been within, usually they like to do within 2 to 3 days. And let's say, like we talked about this 1+1 method, let's say that, you didn't have your female condom, and maybe just your partner may have had their condom for heterosexual couples. And if that is the case, and let's say the condom breaks, you discover this and you say, oh no, I'm not ready to become pregnant. Let me quickly do something to help not allow the egg to fertilize, or excuse me, not fertilize, but not allow the egg. Well, actually it does both. There is some part of the Plan B pill that allows the egg not to try to fertilize. Basically, it creates a very hostile environment for sperm that is in the uterus. And it also allows for the uterus to change the climate so that if an egg is fertilized, it doesn't have a proper implantation. So Plan B, again, is a pill that you can actually get over the counter at the pharmacy. And it really is just high dose regular birth control that changes the body in the two ways that I mentioned, that makes it difficult for the egg to implant or for egg to be fertilized. And again, it's over the counter medication. I believe the last time I may have looked up information about it, it may have been like 50 something dollars. You know, inflation is real, so maybe it's 60 or 75 at this point. I have no idea on that particular thing, but it is something that's available over the counter, and you do not have to have a parent present, at least in most states. You might have to check that out specifically for your own state, but
Counter, like, what do you mean by that? Like, you know, for those of those that don't know, like, do I need a prescription for this, or do I
over the counter? Thank you. Over the counter means that you can walk into Walgreens, Rite Aid, Walmart, anybody's got a pharmacy, and you can pick it up off the shelf. Or it might be behind the counter and you just say, hey, look, I want that Plan B. No questions asked. They'll be able to get it to you. As you know, it might be a cash payment. And for some people, I'm not sure, you might be able to even check to see if your insurance covers it. Right. But again, you know, if you're under the age of 18, you don't have to have a parent. In most states, you will have to check. But in most states, you will not have to have a parent. You can go in and provide.
And so
it's important for teenagers to know, because as a pediatrician, I can tell you that teenagers usually worry, will my parents see this on their insurance?
Mm-hmm.
Is anybody going to see this? And so the answer is no. Like Dr. Lee Allen said, you can go into your local pharmacy and you don't always have to ask the pharmacist. It is right there on the shelf. And yeah, it's anywhere from $35 to $50, like what I said. But it's important that teenagers also understand that.
Yeah. So you're getting kind of into the autonomy and knowing kind of your reproductive rights, health, that kind of thing that we talked about. Yeah. And what, you know, I should add the caveat that it's less effective if you wait for the 3 days. So, and then it can be affected by weight and your BMI as well, which means, like, you know, how much you weigh. Now, there are other effective forms that do require prescription or might require going to the ER. And so in those cases, you know, if you're concerned, you know, those are other options that you might have to seek medical care for. Now, I did want to kind of segue. We talked about, you know, kind of just briefly touched on some alternatives to. So in what situations might, you know, or cases might abortion be life-saving or medically indicated? I mean,
I love the idea of this discussion, because I think, you know, again, reproductive health is about a very large umbrella topic, and it is about also rights, right? So that what happens, you know, when you have a situation where you really have said, okay, I'm pregnant, but I do not want this pregnancy, for many reasons, right? Whether it be that it's actually endangering your life in a physical format, whether it be that you are possibly married to someone who is an abuser, or whether this is not, you know, maybe you're not married. Maybe you are someone who is a victim of rape, someone who is a victim of incest, someone who is a victim of molestation. You know, these are all things that talk about reproductive health and how it impacts you, right? Because now you have these sexual organs that now you're pregnant, and now it's impacting and could be a very stressful time, a very anxious time. It could also be a time that's producing a lot of trauma, particularly if how you became pregnant was very traumatic, right? So these are cases where it maybe, you know, it is not officially a physical impact on your life, but it may be a very traumatic psychosocial impact on your life. So your reproductive right is the idea of, this is not the decision that I want to make. So that's about the freedom to decide if when and how often to do so, right? That's what that
Yeah.
encompasses. The whole repeal of Roe versus Wade was so impactful because it was like, okay, now I don't even have this option on the table. It's not a federally protected option anymore. So it's a big deal. This is a situation where abortion, in the case of, as I just mentioned, when you don't have any other option, there is often a history of women going to illegal routes and going to back alley abortions, particularly even in our communities, where we had young people dying because of illegitimate and illegal and untrained abortions, because they were trying to get out of something and they didn't have that as an option. So
Yeah.
I think, just to kind of to shape things up, there are so many different reasons where abortion is a practical and safe and should be available form of reproductive health option and form of health care.
Yeah, I like Dr. Johnson. Yeah, I like one of these things that I actually really enjoyed over the last year was, I think there was a few episodes like The Shy that kind of that to light. I don't know if any of you are I can't remember the director. Is it Lena Waite? I may have her be saying it wrong, but then there was also some other this episode of The Nick that kind of showed where they were doing abortions, and it was like illegal. But I just kind of wanted to highlight so that people have some facts. But
Yeah, and even for Colored Girls, the movie For Colored Girls, I think they gave a really good example of how young people have been in situations where they didn't have a way to turn and didn't necessarily have a safe clinic like a Planned Parenthood, or just like their regular family physician or pediatrician who they felt comfortable and could go to, and have had catastrophic situations,
I think
including death.
our resident pediatrician wanted to make before I interjected.
I think that it's important that people understand that abortion is part of comprehensive reproductive health. It is not some abnormal or outlier thing. That this is a part of comprehensive, so the full picture of reproductive health, because people should have access to this because of various reasons. Like if somebody, like Dr. Lee Allen already mentioned, someone may not be ready to have a child, or they may be in an abusive situation, and then this is going to tie them even more to their abuser, things like that. But my personal issue with some of the things that are in the headlines lately is that we want to put all these restrictions on bodily autonomy, and yet the people who are trying to do the restrictions are not providing the resources that people need to get full and equal health care, right? And so this once again goes back to understanding our history, because we all know the quote and phrase, like, if you don't know your history, you're doomed to repeat it. But understanding how our history, especially racial injustice, affects our healthcare system now. So not having access to resources, to federal resources.
And say resources, that seems like really nebulous to a lot of our, patients, or a lot of our folks that are listening in. Could you kind of describe, I think in a tangible way, what we're talking about? Like, for example, hey, I'm wanting to get an abortion. Like, what does that mean? Like now in a situation now where we don't have Roe v. Wade, or to allow me to do that.
Well, pause for a second. I think that people also, you need to understand that, okay, so centers are not receiving federal funds for abortions, right? So your insurance is not, like, if somebody is receiving, if they're on a public plan or a governmental plan, they may not have that service paid for, right? So it's really important to understand shutting down a lot of these clinics that provide.
What do you mean government plan though? Like Medicare?
Get into it. I'm mean is like Medicaid or
Okay.
Medicare, right? So anything that is like a government assistant plan, things like that, where you're relying on federal funding. The federal government is providing the funding for your insurance. If you think about it that way, a lot of these health clinics that serve low income families that are being shut down, like that was the only access that some women had, only care they had access to, if that made sense.
Mhm.
So it's what you're putting people, and often low income or Black or brown families or marginalized families, or even immigrants, what you're putting them in this position now is that they're going to have to travel even further to get help. That's already a problem, right? And why does this play off of systemic transportation? For generations after generations after generations, we've had barriers to not only quality healthcare, but transportation, food, different things like that. So you're asking women who may not have access to transportation now to travel across state lines, which is pushing them further into their pregnancy, and then they may not be able to get care. I think those are all the things that I think about, to not go down a rabbit hole.
It's actually very interesting, too, with and some states I know there was even like a moratorium in terms of like a time period that I think you had to go in for an initial visit and then come back for another. So if you live now, and if you live 2 states away, even if, let's say, even if Planned Parenthood or wherever was available, that's potentially like a 300-mile trip or 200-mile trip. And so just to kind of wasn't trying to pin you out on Dr. Johnson, but just kind of give a context for how this really affects patients real time on a day-to-day basis. And so you imagine somebody that's working a 9 to 5 at a regular blue collar job, fast food. They're not doing an Uber type of job, where they can just get in the car and then go the next state over. Or maybe they don't even have transportation or rely on public transportation. This is a real issue.
I think even adding to that, I mean, Liz, I think that was, or Dr. Johnson, I think that was a beautiful segue and really talking about the economics, right? And racialized economics and how that plays into all gamuts of life. I mean, because I think about also, so not only if my parent or my child is on Medicaid, if that's the case, there are some legislation that they're trying to move and push into even restricting access to even birth control, the other alternatives. So now what happens to those people who are on plans that don't cover birth control? What happens to that group and that segment of people? And then also I think about the idea of, history and racialized economies, because in many inner cities, we have very large Black and brown populations. What happens when, because of funding to public school systems, we no longer carry health education? We don't talk about, where someone who is in the suburbs and they are in a public school, they're talking about health education. They're talking about birth control. They're talking about, classes that cover these topics. So there's so many different, reasons why some communities or young people in some communities may not be as well educated as young people in other communities, or have access as young people in other communities. And I only bring this up because there was, an article in the news that talked about, well, why is it that inner city young people have more unplanned pregnancies? Well, we have to think about the context.
You're kind of hit on some excellent topics about systemic issues about that contribute to kind of unplanned pregnancies, and then you also talked about social determinants of health, which are kind of are some of that umbrella that factor into why communities are the way they are and why they don't have the access, and why certain places maybe historically remain, I think, underserved and the health tends to be poor, and so it may not be necessarily where it may just be where you live and your zip code that dictates, what you
Very
have.
important. I think that people, yes, this goes back to history. So why do historically Black and Brown communities not have the resources, right? So understanding that in the 1930s that the federal government began the practice of redlining. And so this was through the federal housing administration. What?
Yeah, what is that exactly, redlining? I mean,
So I'm going to get to that.
okay, all right, cool.
Well, the Federal Housing Administration basically mapped neighborhoods based on how secure they were to invest and redlined Black neighborhoods as the highest perceived risk. So if you were in a highest perceived risk area, certain resources were not being sent to that area, right? So, and that's often where they put those areas were predominantly occupied by Black families. So how does this show up in healthcare? Those resources also mean like funding that goes to your hospital. So we are getting the funding that we need to even provide adequate healthcare because you just don't have those resources. So that affects your health. This is systemic racism is literally in everything.
Right. Yeah, and you're actually, hitting on a lot of nice pearls that I think are really going to factor into a lot of the discussions that we're having down the line, particularly like financial literacy and then financial health, how that how financial literacy contributes to your health, and even talking about those things that your allocation of resources. Because, if you didn't have the finances or you don't necessarily have that access, your zip code truly does dictate, what your access is. Maybe even from houses and being able to have an adequate housing, home, water access. Think about places like Flint, Michigan, that have been affected by a lot of different things. So, I did want to pull it back to what we talked about, which is abortion. Like, so there are instances where it is medically indicated. Like, for example, someone may have a pregnancy in their tube, which is called an ectopic pregnancy, which is a life-threatening situation, because once that pregnancy grows, to the point where it ruptures, somebody can potentially bleed to death. They can die. And, so that might necessitate a procedure being done. So that's one instance, but definitely the instances that you guys talked about, rape, abuse, all of those things. And those are often topics that we don't necessarily discuss when we're having these conversations in our social circles, or which is why voting and all these other things are important. So I think I interrupted you, Dr. Johnson. Was there something else you were going to mention? I made you train of thought. I apologize.
It's okay. I have the type of brain sometimes where it's like squirrel, and then
But
I'm going to the next thing.
Right. So I kind of did want to talk about, shifting gears, and, what about the downstream, the negative downstream effects of actually having an abortion, because I know we think about, life-saving situations, what are some potential downsides, like from, of having abortion?
So say if you are using some and it's not completely effective and you still have retaining parts. So which means that all of the components of the baby did not leave the body, and it's some stuck in the uterus. So having infections that's related to that, infections and bleeding, that can be life-threatening.
Mm-hmm. Yeah. And so, yeah, definitely. And that's another issue about access, why access is so important, because what she's getting at is the potential for what we call a septic abortion, where not everything is evacuated from the products of conception are not evacuated from the uterus, and somebody's still bleeding. Well, if they don't have access to facilities that can with trained individuals that can adequately take care of this issue or render care, that becomes a problematic. The other portion of that is, if they have an infection and people that are inadequately trained to do this, it could be potentially result in death. But I also wanted to talk about like maybe, and we didn't have necessarily expounded on that, abortion is not a benign thing. There is definitely some psychosocial aspects of things, which is why I think the contraception piece and all the other things that you were talking about. And I think this might be one of the things that, has been discussed in the community. I don't know if anybody can mention about that, or feel free to, chime in about that portion of things.
Well, I think when we talk about abortion and, like you mentioned, it's not to be taken lightly. I know that I've even had, very close friends in my circle, and even, growing up, hearing other people's stories about their decision to have abortion, and the impact that it had on them. The fact that, emotionally, they still felt like there was a connection to someone that they could have brought life to, and that decision was very difficult, and it weighed heavily on them. They didn't take it lightly. And even, just kind of doing some of my own research when Roe v. versus Wade was repealed, to learn, because there's sometimes this thought that, oh, people are using abortion for birth control. There's this, and it's really a misconception, because according to the statistics by a number of different like Gutmaker and Kaiser Family Foundation, when they actually do the statistics of women who have abortion, by far, over 50% of the women have only had one abortion. There is less than 20% of women who have had, like, let's say, more than one abortion before that the study took place. So it's to say, by far, most women who have abortion have never had one before, and it's only a very small minority of women who have had more than one abortion. So I think that was interesting. I think many, based on those statistics from different studies, most women do not use abortion as a form of birth control. It seems like, again, as you said, because there is a lot of the time, energy, and emotional decision and an emotional, weight to having an abortion that comes with it. So based on our statistics, most women do not take it lightly. Most women are not using abortion as their primary form of birth control. So I think, again, just to make sure that we dispel that myth, that's definitely a myth.
So I know we've kind of hit on a number of these different topics. As again, we mentioned, we're just kind of touching the surface of reproductive health. It's all encompassing. I guess I just wanted to get your final thoughts about, from your different scopes of practice, what are some big take homes that you feel like we should know, or you kind of impart to your patients when you are talking to them, or if you were going to talk to a family member, a sister, a brother, or anybody else, because again, reproductive health is such a broad topic, and it's not what we tend to think about.
I'll start. So, just a few things. Contraception, so many choices, patches, pills, implants, condoms, just so many different options. Please choose one if you're hoping to prevent pregnancy. Say it one more time.
When should they start?
Before you think about having intercourse. But then also, if you do find that you're pregnant and you don't want the pregnancy, adoption is also an option. Directed adoption, where you choose who your child goes to, is also an option, because there are plenty of families who do want children and are unable to do it themselves. I work, even though I said family medicine, I'm working primarily in geriatrics. So Just because you're getting older doesn't mean you can't still have sex. Things get dry, we can help you. Don't think that it's an overactive bladder. It could be vaginal atrophy. We can do something very easily over the counter, make things so much better. And then also, as you said, erectile dysfunction. There are different aids that help with that too. So aging
Yeah.
well.
Yeah. And what she's mentioning is just kind of hormone replacement therapy, to kind of address any vaginal dryness and those kind of things. So those are excellent. Thank you, Dr. Ellison. Dr. Mahdi, what you got for us?
So like I think in the past, I guess the past year, this Roe versus Wade's kind of like played a huge impact into healthcare, especially reproductive health. And one of the things about especially healthcare providers, we want to offer choices to our patients. So if this is something that affects you or people around you, I think one of the things you need to do is kind of be educated about the laws in your community and where you live at and see exactly what you can do to impact those changes, especially understand exactly if you have a doctor. If you don't have a doctor, find a doctor that you can trust, get information, what you have available to you, but also know exactly what's available to you. I think having an initial discussion so you know exactly what you can do to protect yourself is initially key. So hopefully that's something that our people are actually listening to and hopefully can implement that.
Yeah. And I really like that thing you mentioned about the one-to-one. I mean, I think that's something that we think about from a healthcare standpoint, but we don't necessarily talk about or counsel patients on. So I definitely, I like the fact that you mentioned that. And I think the other part you kind of touched on was also maybe reproductive responsibility from the man's standpoint. Hey, you're using a condom, but make sure, your partner is maybe also on some contraception too, because things can happen. Condoms are not 100, or barrier methods are not 100%.
That's true.
Yeah. And to see Allison, the little blue pill thing. I appreciate that.
See Alice guy.
Dr. Johnson?
Okay. So as you know, I've said earlier, I'm a pediatrician and everybody gets really uncomfortable when when we talk about sexual education in children. But it is important. Why? Because it's important that our children know the facts, and when they know the facts about their health, they're more confident and they can stay safe and healthy. So it's about teaching them or providing sexuality education promotes human dignity. It promotes self-determination, bodily autonomy, things like this. This ensures that our children not only, know how to treat others with respect, but how their bodies should be treated with respect. It ensures that our children learn how to stay safe. When they know about their bodies, they can also tell you when something's wrong. And when they know about their bodies, they can also let us know when someone is mistreating them. So them understanding, what's going on can keep them safe all around. So that's my charge as a pediatrician, is to be a child's advocate and make sure that they are they're the best versions of themselves and be protected. So knowledge is power. I feel like that applies to all areas of life.
And the other portion of that too was that I really love that you touched on too, is like that idea of advocacy, because now more and more our youngsters are, exposed to, are having, I guess, experiences earlier and earlier on. I mean, I'm so surprised, I think, as a gynecologist, when I see those patients, and I'm sure you probably have the same experience as a pediatrician, and it can be kind of challenging talking to parents.
I think that I'll say this to the parents that are watching. If you do not feel comfortable having those conversations with your children, it doesn't mean that they shouldn't happen. It just means find a pediatrician that you trust and that can build a rapport with your child so that your child feels safe and your child can ask those questions, because just because they aren't asking you doesn't mean they don't have those questions. And would you rather them turn to a trusted adult, or would you rather them turn to social media to find out, right? And that's what often happens, is that they turn to social media or they turn to their peers to find out. And I don't need, I know this might sound young, but I have heard all sorts of things from teenagers, but I don't need a 13-year-old getting information from another 13-year-old. It's not a good thing, okay? So
Right.
just because people don't want to talk about it doesn't mean that kids don't have questions. They have questions about their body. It's not, and they shouldn't be made to feel ashamed for having those questions. So
Yeah.
if you don't think that you can handle having that conversation with your kids, that's okay, but make sure that they get to have that combo with someone.
And for the parents, some of these infections which we kind of briefly touched on in the beginning of our discussion, they can have downstream effects on fertility. And when I'm speaking about fertility, I'm talking about the ability to get pregnant. And, it can happen as early as whenever they have their first episode or sexual interaction, because there's some infections that can be asymptomatic and can actually cause, very detrimental effects. So I just wanted to impress upon you that, to be aware of those things. Dr. Al, yeah, Dr. Allison.
It's not just like sexual health, reproductive health. It's about making sure they take charge of their body and they know when something's wrong, right? Like young boys can also get, testicular cancer. There can be that. And I've had patients that I applauded them when, I've had a teenage boy that came in and was like, there's something really embarrassing, but something's wrong. You don't need to be embarrassed. This is your body. I'm so glad that you trusted me and that you came to talk to me. So it's not just about, sex.
Yeah.
Health is making sure that they live a nice, long, and prosperous life.
Right. Absolutely. And it's knowing, and to her point, it's about knowing what's normal and what's abnormal as it relates to your body. Is there abnormal? I have, testicles. Is there something do I feel an abnormal lump? Or, I have breasts. Is there abnormal lump there? Because, teenagers, there's different cancers and different things that can affect male or female children at any age. And so, we have to be aware of those things. And even from the colon, our GI specialist will even tell us there's some colon or GI issues that can affect us. So Dr. Allen, if you kind of chime in for us.
Yeah, absolutely. I mean, I think the beauty of medicine, and why we got into this, is to really help people to understand how to be their most abundant selves and how to be as healthy as possible, right? And as Dr. Johnson, as Dr. Ellison, as Dr. Amadi, and as you, Dr. Ikwezuma, had just mentioned, there's so many different conditions that impact our sexual organs. And from mental health all the way to other physical health. And even as a GI doctor, I see patients who come in and say, well, I have GI symptoms that are most prominent during times that I'm on my menstrual cycle, or during times that I'm underneath a lot of different stress. So I think, just understanding that, something might be wrong, as Dr. Johnson just immediately said, it's important. It's important to know those sexual organs. It's important to know, how do you take care of your breasts? How do you take care of your vaginal area? How do you take care of your testes? How do you take care of your penis? All of these things are important, right? Even when we talk about young people, and we started talking about COVID vaccinations. Guess what? There are vaccinations for our young people to protect their sexual organs, to protect us from things like HPV, which is a virus that people can carry and not know, right? I've seen, as a primary care doctor, young people come in their 20s with ovarian cancer or with uterine cancer. So knowing when your cycle is off, knowing when you're not, maybe just not peeing the way you normally do, knowing when you are feeling a certain lump, as Dr. Johnson already mentioned. So just understand that, we do this because we care about our community and we want to reach people who you may not ever see us in clinic, but we want to be able to give you education and information so that you can still have a healthy and safe and productive life. So I can't wait for this year of 2023, where we're going to be talking about so much more, all underneath this umbrella. So
Yeah.
Guinea, take it away. Maybe if you want to give them what we're talking about, hopefully around March or April, and what we're talking about maybe around June or July.
Absolutely. So, I wanted to first kind of just thank all of our esteemed panelists for their time and effort. We really appreciate, all the knowledge that you kind of imparted to our viewers. But we know we just only touched on the surface of reproductive health. There's so much more that kind of encompasses that. And to the point of Dr. Allen, what she was mentioning, as well as a lot of our panelists, we're talking about, we'll be talking about infant and maternal mortality. I know many of you requested a lot of these throughout the last year as we were talking about our COVID topics. So we're going to be hitting on that. She mentioned about Serena Williams. There's prominent folks in the community, whether you think about Beyonce, Janet Jackson, these folks that have had, what we call pregnancies when they were, maybe a little bit past their prime. In our, what we call it in the medical community is advanced maternal age. And as a lot of us are aging gracefully, particularly in our community, where we have a lot of women that are professionals and a lot of males that are professionals that are seeking to have start their families or blended families, at older ages. You start to get into a lot of these things that we're talking about, kind of touched on here about reproductive health, because and then fertility issues, because those things can affect whether you're thinking about planning, you're talking about the ability to get pregnant. We're going to be talking about fertility issues as it affects men and women. We're going to be talking about, the financial aspect of all that, the planning. Are you ready to have a child? What are all the caveats of that? Talking about, Dr. Amadi mentioned a little bit about making sure that your organs are working and everything is really in tip-top shape. The plumbing is up to scratch. We're going to be talking about that from, hypertension, kind of optimizing your health prior to even getting, pregnant. So a lot of topics. We're really excited for this year. I know as someone that takes care of women throughout the different aspects of their life, from the younger generation to our more geriatric population, this is a hot topic, and really something that I particularly enjoy, especially since I've just become a father. So I wanted to just encourage you to like, subscribe, and tune in to Young Black Docs and some of YBP, Young Black Physicians, and some of the talks that we have coming down the line. Thank you, and make sure you stay tuned.
Happy MLK Day.
Happy MLK Day.
Happy MLK Day.